Hello, I'm Latoya Foster, and the question I'll be answering are from track and field athletes, both male and female, with with age ranging from 19 to 27 years old. The question proposed is: does kinesiotape help relieve pain with shin splints for those who are flat-footed during competition? So first, we must understand what shin splints are. These are micro tears that occur in the soft tissue around the mediotibial bone, also known as the long frontal bone in the lower leg and the shin itself. Pain is typically caused by the overuse and overtraining of the surrounding muscles, tendons, and other bone tissues in that area of the shin. So specifically in track and field, athletes are consistently going in a forward motion as far as running, jumping, not so much agility like you would see in soccer or basketball. So it's very linear for most events. So there's a lot of force that's inflicted upon the shins and those other frontal muscles, either at a fast pace. So if you are a sprinter or a jumper, you're typically going very fast, or even for a long duration of time. So if you are an 800-meter runner or anything beyond that, that could also be something as well that contributes to the shin splints. Footwear can also be a factor. Runners do interchange their footwear as far as changing from their training shoes to their spikes for competition and in practice. So to be aware of that or to take that in consideration as well. Sharma and Senna found in a study in 2017 the difference between kinesio tape and the traditional white non-elastic athletic tape that is typically used. And that their differences come from the textures and material that they are both made out of. So kinesio tape is more like a wavelength. It's kind of grainy, elastic, adhesive material. And what it does is that it mimics the thickness of the human skin. Sharma and Senna found in a study in 2017 that once it's applied, it does provide the appropriate tension to the pain site. And it also, at that point, is functional. So its main function is it lifts the fascia and soft tissue, which is the skin itself, and it's pulling the skin upward. And what it's doing from there is that it's creating a linear space that allows extra fluid and edema to cycle back throughout the body. And then it's also allowing better blood flow. So better blood circulation and making sure that the blood is going back and normalizing muscle function by realigning the functional fascial tissue or soft tissue. So for those who are flat-footed specifically and is either a sprinter or a jumper or even a thrower, Menraw and colleagues found in a study in 2012 that the navicular drop distance is a contributor. So here in this study, they have measured the use before and after kinesio tape, specifically after running in this case. So Monroe and colleagues found in a study in 2012 that the relative plantar pressure, rating of perceived exertion, and visual analog scale were taken into account. So after the application of kinesio tape over the tibialis posterior and transverse arch, so just the arch of your foot, the navicular drop distance reduced significantly, and it also reduced in the posterior pressure as well. Monroe and colleagues, 2012, explained that kinesio tape is also to facilitate the tibialis posterior and reinforce a transverse arch that can essentially reduce the navicular drop, which is what we want because we don't want the arch to collapse. The posterior tibialis is just the back of the shin bone, if that makes sense. just because those regions and origins are connected there. And for those who have flexible flat feet or um, really bad flat feet, the navicular sits right underneath the talus, which is the ankle bone in the front. So the navicular bone is a little flatter, and it comes across the top of your foot. So some people refer to the top of the foot, and it's parallel to the arch. So when the arch drops, that's what we don't want, and that's what the kinesio tape is there to help prevent, with applying it in the right areas, as explained in the study. So Monroe and colleagues found in 2012, in that particular study, the same study, that once the kinesio tape is applied, the runner should feel some relief within 15 minutes of running. Lastly, also with the previous study, Sharma and Sinha, 2017, they've also ensured that the effects of kinesio tape will immediately reduce pain and relieve the symptoms of shin splints during competition and training.